Aging and vision. What should you know from this lecture? The first one, what is the visual impairment among older adults? And the second one will be what is the effect of aging on vision. The growth of the older adults population, which is population aged 65 years and over, is one of the most significant demographic trends all over the world. The world older adults population is rising due to decline in fertility and increased longevity. Globally, there is approximately 9% of the adult aged more than 65 years in 2019 and is expected to reach 12% in 2030 and 60% in 2050. The same phenomenon occurs in Malaysia as well. Population census showed an increment of Malaysian older adults from 6.3% in 2017 to 6.5% in 2018 and is expected to reach more than 7% in 2020. This diagram shows the trend of aging population in Malaysia. We can see the increasing number of older adults population by 2040 until 4 times. Based on the Malaysia Population Housing Census 2010, it shows females were the majority among the older adults in Malaysia. Perak was the most aging state, followed by Perlis, and the most aging ethnic was Chinese, followed by Indians. Changes in the population age structure can be described through the population pyramid. Based on the population pyramid, in 1957, the shape of the population pyramid is progressive with a broad base, concave slope, and sharp peak. In 2010, the shape of Malaysia population pyramid was regressive and expected to remain as such until 2040. Regressive pyramid has a smaller base which indicate low birth rates and convex slope that reflect low mortality rates of the older adult population. The apex, which is flat and wide, show a more older adults population. With this aging of population, the prevalence of visual impairment is also expected to increase as well. In 2015, globally, the prevalence of visual impairment was 6%, and from the 6%, about 84% of the prevalence was among older adults, which is 50 years old and above. Based on the classification of developing and developed countries, it showed that the prevalence of visual impairment in older adults in developing countries was between 11 to 28% and in developed countries was between 1.4% to 5.7%. How about Malaysia? Based on the National Eye Survey 2, it shows that the prevalence of vision impairment among older adults was 7.6%. In addition, based on my report on 2020, it shows that the prevalence of vision impairment among older adults in Selangor was 27.3%. These two studies regarding the prevalence of vision impairment in our country conducted by me in 2019 and 2021. Please read this journal for your more information about the prevalence of vision impairment in Malaysia. The anatomy of the eye. The eye is a unique sensory organ because there are several transparent structures which light can penetrate. In order to have clear vision, every structure in the eye needs to be in a good condition. Objects can be seen when the light from the object enters the eye through the structure of the cornea, then the pupil, crystalline lens, and finally form an image on the retina. Then this image information is sent through the optic nerve to the brain, which will interpret the image. Generally, vision loss can be caused by uncorrected refractive error or eye disease. Uncorrected refractive error causes objects to appear blurry because the image is not focused precisely on the retina. The eye disease causes changes to the structure in the eye and subsequently affect vision. The problem of blurred vision due to uncorrected refractive error is one of the problems that will be experienced by individuals aged 40 and above, including the older adults. In addition, cataract, glaucoma, dry eyes, and macular degeneration are eye diseases that often occur due to aging. There are many eye diseases that do not show any sign of, example, glaucoma. However, now with regular eye examination can help the older adult get confirmation and treatment of eye diseases earlier. What we will discuss after this were age-related changes in visual acuity, refraction, and ocular health. Beware that visual impairment due to eye problem and disease can have an impact on individual ability to do daily activities such as walking, cooking, watching television, recreation, and etc. Age-related changes in visual acuity. Although the majority of individuals retain good high contrast visual acuity, with correction if they are needed, until their age 70s, contrast sensitivity, low contrast visual acuity, and visual acuity in the presence of glare tend to show deficit as much earlier ages. This table shows the result of two studies, which is by Klein et al. 1991 and Elliott et al. 1995. One of the largest of the study of age-related visual acuity was the Beaver Dam study by Klein in 1991. In this study, all subjects who volunteered for the study were included regardless of any sign of ocular disease. Based on this study, 99% of the subjects between the age of 43 and 64 years had corrected visual acuity of 6/6 or better, reducing to 95% between age 65 and 74 and 79% between age 75 and 89 years. Another study by Elliott in 1995 involving 223 subjects between the age of 18 and 75 years having normal eye and healthy eyes. The Valley-Ravi chart was used to measure corrected visual acuity specific in LoCMA unit. The mean visual acuity was found to be 6/44, 4.2, which is LoCMA minus 0.12 at age 45 to 49, reducing to 6/6 with LoCMA 0.0 over age 75. You can refer to this table for the comparison of the result of these two studies. Unlike high contrast visual acuity in low contrast and contrast sensitivity decreased markedly with increasing age. There is growing body of evidence shows that pathological changes such as cataract and macular degeneration can cause significant loss of contrast sensitivity for certain spatial frequency. These figures show the changes of contrast sensitivity based on age. This figure indicates that older subjects for all age had approximately equal sensitivity for the lower spatial frequency, 0.5 and 1.0 cycle per degree. There was decrease in sensitivity for higher spatial frequency for each decade of life. A cross-sectional study by Hagstrom Portnoy in 1999 has shown significant loss in non-standard vision measure in old age. This table shows the low contrast visual acuity and sensitivity to glare. Reducing the level of the contrast or adding glare significantly decrease the measure function in older adults. Study by Ramsey in 1993 which compared the visual acuity, contrast sensitivity, glare sensitivity and other functions for older group which is 68 to 87 years old and middle age group which is 40 to 60 years old. The result shows a decline distant vision was reported by 72% of the older group but only 10% of the middle-aged group. Complaints of diminished driving ability were reported by 45% of the older group and by 25% of the middle-aged group. Problems with glare were reported by 49% of the older group and by 30% of the middle-aged group. In discussion of these results, Ramsey suggested that when taking histories, more specific, task-oriented questions might more effectively identify decrements in visual function. Age-related changes in refraction. In refraction, patients could have emmetropia, which is no refractive error, or they could have refractive error, which is myopia, hyperopia, astigmatism, or presbyopia. Now we will discuss about three conditions, which is presbyopia, hyperopic shift, and astigmatism that could occur in older adults due to aging factor. Age-related changes in refraction. Presbyopia is the most obvious age-related changes in refraction, which is the gradual loss of the ability to accommodate. Normally, these conditions start at age 40 years old, but it depends on the status of refractive error. Either patients are emmetrope, hyperope, or myope. Clinical experience shows that hyperope may get presbyope at an earlier age than emmetrope, while myope may not get presbyope until a later age. The reason for this is that spectacle lenses are placed about 12 mm in front of the cornea and the factor of the accommodation. To overcome this condition, patients need to wear a reading glasses or multifocal spectacle or bifocal spectacle. Hyperopic shift is another age-related changes in refraction, spherical refraction, or refractive errors. It has been known to occur in hyperopic and emmetropic eye but not necessarily in myopic eyes. At the beginning, Donde speculated that the hyperopic shift was due to a gradually flattening of the surface of the crystalline lens with the growth of the new lens fibers. However, it is now understood that the lens surface actually steepens with age and that the hyperopic shift or lack of myopic shift is due to a decrease in the gradient index of the lens. Astigmatism is a refractive anomaly in which the eye optical system is incapable of forming a point image for a point object because of refracting power of the eye's optical system varies from one meridian to another. We can describe the astigmatism either with the rules, against the rules, or oblique. It is depending where is the location of the astigmatism. However, a common observation among practitioners is that during the presbyopic years, patients who have no astigmatism tend to develop against the rule astigmatism, and patients who have already astigmatism change in the against the rule astigmatism. Age-related ocular health problems. So in this topic, we will discuss about the problem with the lacrimal system and also the prevalence of dry eye in older adults population. It hardly need to be said that with increasing age, there is an increasing probability of the occurrence of ocular health problems. Although many age-related ocular health problems are vision-threatening, there are other less serious problems which can cause blurring of vision and other symptoms. This diagram shows the lacrimal system in the eyes. This system will involve in formation, distribution, and also elimination of tears. Problem with the lacrimal system. One of the most pervasive age-related vision problems has to do with the formation, distribution, and elimination of tears. These three processes are related to lacrimal system. For example, dry eye syndrome. It is due to insufficient aqueous tear secretion, as we can confirm by shimmer tear test, which is less than 10 mm. Another factor that can cause dry eye syndrome, which is due to a deficiency of the mucin layer, which is we can confirm by a tear breakup time, which is less than 10 seconds. Another example is keratoconjunctivitis sisca. This condition is related to the dry eye condition that has been described by Lam as predominantly as a disorder of menopause and postmenopause for female. And the last one is Sjögren syndrome, which is consisting of a triad of dry eye, dry mouth, and also arthritis. Prevalence of dry eye in adult population. Based on the Beaver Dam study, they found that the incidence of dry eye was found significantly associated with age. The prevalence of dry eye among population 43 to 84 years old was 13%. The contributing factor in age-related incidence of dry eye, which is greater in patient or subject with history of allergy, greater in patient or subject with history of diabetes, greater in patient or subject with antihistamine or diuretic, greater in patient or subject with poor or self-rate health, and also greater in patient or subject which is consuming alcohol. This two diagram shows the common symptoms of dry eye and also how to treat dry eye problems at home. For the symptom, you could have burning sensation, excessive tearing, redness. You also could have a blurred vision and also sanding or gritty sensation. And there is 6 ways to treat dry eye problems at home, which you can advise your patient to do. The first one, you can ask your patient to have warm or cold compression. Ask the patient to use artificial tears when they feel very dry. You can advise patient to use or to wear sunglasses. And advise patient to clean the eye areas. You also can advise patient to use a humidifier and make sure that your patient always stay hydrated. Age-related vision loss. The major cause of vision impairment or vision loss occurring during the later year of life were age-related macular degeneration, or we can call it as AMD, diabetic retinopathy, glaucoma, age-related cataract, myopic choroid retinal degeneration, and also retina detachment. After this, I will describe briefly of the conditions that cause age-related vision loss. The first one is age-related macular degeneration or AMD, also known as age-related maculopathy, which is the most frequent cause of vision impairment in older adults. We can describe this condition because of ultraviolet and blue radiation, because it's relatively high energy, which is initiate a destructive process by producing free radicals that damage the stats of these in the outer segment of photoreceptors, causing them to slough off into pigment epithelial cell. As a result, lipofuscin granules are formed and are deposited on branch membrane in the form of drusen. This is the earliest sign of macular degeneration. Drusen have the property of separating the pigment epithelial cells from the blood supply, resulting in the death of the photoreceptor. We have two types of AMD. Either your patient could have atrophic macular degeneration, or we can call it as a dry AMD, and also exudative macular degeneration, or we can call it as wet AMD. What are the risk factors of AMD? we have a few risk factors of ND, which is age, genetic susceptibility, light color eye reddish, exposure to radiation from the sun, cigarette smoking, and also a lack of dietary antioxidant. The next one is diabetic retinopathy. Diabetic retinopathy usually follows the onset of diabetes by many years. A person who is at risk for diabetic retinopathy almost always knows that he or she had diabetes. We have two types of diabetic retinopathy, either early diabetic retinopathy or advanced diabetic retinopathy. For early diabetic retinopathy, this is more common form and also called as non-proliferative diabetic retinopathy, NPDR. In this type, the new blood vessels are not growing or proliferating. The next one is advanced diabetic retinopathy. At this stage, diabetic retinopathy can progress to this more severe type, known as proliferative diabetic retinopathy. In this type, damaged blood vessels close off, causing the growth of new or abnormal blood vessels in the retina. The new blood vessels are fragile and can leak into the clear, jelly-like substance that fills the center of your eye, or we call it as vitreous. Now I will briefly discuss about the glaucoma. Normally we call it the snake teeth of sight. Glaucoma is a disease in which the pressure within the eye, or we call it as intraocular pressure, which is so high that it causes damage to the retinal nerve fiber and rod and also cones, which is causing visual field loss. The intraocular pressure, or IOP, can be measured using tonometer, and the normal value of the IOP range from 8 to 21 mm mercury. For other primary glaucoma may occur as angle closure glaucoma, which is caused by an anatomical narrow drainage angle, which is more likely to occur in a small hyperopic eye having a shallow anterior chamber. As the eye lens grows with the passage of years, the anterior chamber gradually becomes shallower and the angle becomes narrower. Remember, in this case of a severe angle closure attack, loss of vision can occur within 24 hours. The next one is open angle glaucoma, which can occur in any eye, regardless of the depth of the anterior chamber, and typically cause no symptom. Myopic eyes typically have deep anterior chambers and wide drainage angles, and are unlikely to suffer angle closure. But they are not immune to open angle glaucoma. The next one is normal tension glaucoma, which can result in visual field loss in spite of the presence of normal IOP. So what is the symptom of the glaucoma? Symptoms of the glaucoma in open angle glaucoma systems are very seldom present because visual field loss can occur gradually due to a small increase in IOP during a period of many weeks or months. In angle closure glaucoma, blurring of vision due to water absorption by the cornea, severe headaches, and gastrointestinal symptoms due to stimulation of sensory nerve and vagus nerve to the abdomen. It often occurs that the headache and gastrointestinal symptoms are so severe until patient is not aware of any vision problem. The symptoms usually subside in a matter of several hours. Next is age-related cataract. The detection and diagnosis of both age-related cataract is based on both patients' complaints and the clinical findings. It happens when clouding of crystalline lens because of the aging process. The patient may have fade complain of poor vision, often in specific situations such as low illumination when the pupils are widely dilated, normally it is nuclear or cortical cataract, or when looking towards bright light when the pupils are constricted, and normally it happens in posterior capsular cataract. High contrast visual acuity may be relatively good in spite of the patient complaint of poor vision, but low contrast acuity and acuity in presence of glare is often be poor. So what is the risk factor of age-related cataract? The risk factor of age-related cataract is the same with the AMD, which is age, genetic susceptibility, light color iris, exposure to radiation from the sun, cigarette smoking, and also a lack of dietary antioxidant. Myopic choroid retina degeneration, which is occur as an accompaniment of moderate or high myopia, beginning a posterior staphyloma with cupping of the optic nerve head and an optic nerve crescent, which may eventually surround the optic nerve head, and followed by area of pallor and pigment disruption in the posterior fundus, and in rare cases, a macular hemorrhage leading to the development of Fuchs spot. The last one is retina detachment. Retina detachment is a splitting within the retina in which the retinal pigment epithelium becomes detached from the rod and cones and other layers of the sensory retina. The figure shows the process of the retina detachment. And this figure shows the example what patient with retina detachment see. Effect of age-related vision problems on daily living. Experience shows that when vision impairment occurs during the working years or the later adult years, the most common problem is difficulty with reading and other near work. As for difficulty seen for distant vision tasks, a common problem is the inability to see well enough to drive and to maintain a driving license. Reading and other near work. There are many ways in which an optometrist or practitioner can assist a vision impaired person whose major problem is difficulty with reading and other near work. Relative distance magnification is the form of magnification that occurs when reading material is held closer than usual reading distance of 33 to 40 cm. For a person of presbyopia eye, this simply means that a stronger than usual aid will be needed in the form of reading glasses, bifocal or progressive addition lenses. Other methods of providing magnification for reading and other near work are by use of ordinary of the shaft hand magnifier, stand magnifier, or CCTV, which is provide almost unlimited magnification. This is another study from me which is related to near vision impairment and daily activities among older adults. Please read this journal for your more information about the effect reading and other near work because of vision impairment among older adults. Driving and age-related vision problems. Although 95% of older adults aged 64 to 74 and 80% of older adults over age 74 have been found to have 6/6 visual acuity, however, driving requires much more than high contrast acuity under optimal testing conditions. These are a few research about driving and cataract among older adults. It shows that the older drivers with cataract experience a restriction in their driving mobility and a decrease in their safety on the road. The current two reports here was a study from Malaysia, which is I'm the leader of the project. Please read this journal for your more information about the driving and age-related vision problems among older adults. This is the report from the LRGS tour project, which is conducted among the older adults in Malaysia. So based on this project, we found that about 1 in 4 subjects have significant hearing impairment. For the vision impairment, nearly 1 in 5 subjects have vision impairment. In the same time, some of them, which is about 14% of the subjects, have both of the problem, which is we call it as dual sensory impairment. If you look at this diagram, it shows that only 4.4% own their hearing aids and about 63% own their own spectacle. And this project also shows that some of the subjects having hearing problem or vision problem, or it could have dual sensory impairment. So you need to understand that for those who are older adult, they could have either single sensory impairment or dual sensory impairment. Based on this report also, what we discussed just now about the daily activity only, but those who have this problem actually could have a cognitive impairment also. And those who are having both hearing and vision impairment could have more cognitive impairment, which is 4 times more likely to have poor quality of life and also 7 times more likely to have poor cognitive function. For the summary, the prevalence of vision impairment among the older adults, including in Malaysia, is high. The age-related changes in vision could be changes in visual acuity, refraction, ocular health, and also vision loss. The effects of age-related vision problem could be on the daily activity living, such as reading, near tasks, and also driving. And the effect of age-related vision problem also can be on the cognitive function. That's all for me. Thank you.